Assalamu alaikum and good afternoon. I am Dr. Tasneem Hossain, a radiation oncologist working as assistant registrar at NICRH. Today I will share my idea about how smart system and financial protection can transform cancer care in Bangladesh. Every day I meet people like Mrs. Rohima Begum, a 42-year-old mother who was diagnosed with cervical cancer but presented to us 1 year later. It was not because she didn't want treatment, but because she was afraid to come because of the cost of the journey, the cost of diagnosis, and the time off from her work. But when she finally arrived at our hospital, there was another wait, the queue of radiotherapy. Rohima's story is the tale of hundreds, if not thousands. It reflects a national crisis, the crisis which has two phases. One is systemic. Bangladesh has more than 170 million people where at least 150 radiotherapy machines are needed, whereas we have less than 35 working machines. So there is a long queue. Another is financial. Bangladesh spends a negligible percentage of GDP in health. Most of the treatment cost comes straight out from the patient's pocket. Every bus fare, every meal added to the cost. Poverty plus delay results in advanced diseases. Before establishing more machines, we have to think smarter with better triage system, shorter treatment schedules, which we call hyperfractionation, and extended treatment hours, like an extra shift. We can treat more 20 to 40% patients. Another spare parts pool in collaboration with the vendors of the machine, or IAEA, which will reduce machine downtime when machine got broken. Technology is not only the issue, but also finance. That's why we design hybrid microfinance for cancer care. Families will contribute as low as 10 to 30 taka weekly to community health funds through an insurance company. It will cover up to 1 lakh taka per year for each family for cancer care. This covers screening, diagnosis, and treatment. A reinsurance pool supported by donors, Islamic Waqf funds, and also Zakat are there for the catastrophic cases. NGOs like BRAC, Grameen, insurance companies like MetLife, hospitals like NICRH and other government hospitals, and communities will work hand in hand. The result will be fewer Rohimas waiting in advanced stage and more cases being early diagnosed, more families staying alive. Healing the wait means managing queues smarter and protecting families financially. Let's make sure cancer doesn't test our bodies, rather it tests our compassion, our system, and mostly leadership. Thank you all for your patient hearing.
Now, thank you so much. Now, question answer session.
Thank you for your presentation. Can you tell me why do you believe that this model will help with machine maintenance?
In my thought, there are two aspects. One is related to the machine, and another is financial. Related to the machine maintenance, we can create a spare pool part because when the machine breaks down or when the machine is not working, patients have to wait even longer and the queue gets even longer. So if we can create a pool in collaboration with the vendors of the machine or IAEA, etc., we can decrease the machine downtime, and we can even give care better.
Dr. Hossain, you started off with the difficulty of access to care and as well as the financial difficulty, but I couldn't relate your subsequent kind of part of the presentation with that. So having machines overworking or things like that, extra shifts, how that will bring that patient the waiting time or things like that, or the barriers to access, how do you sort those issues?
My thought was that we cannot give serial to the patients for radiotherapy. It's not a problem of the radiation oncologist only, but it is a problem of the community. The community also should come forward to form a pool of insurance where the families will also contribute as low as 30 to 40 taka per week. And if any member of the family gets affected by cancer, then he will get 1 lakh taka per year per household. So there will be a pool. So as radiation oncologists or as clinicians or member of the health facility, we have some ideas which we can pursue or which we can establish, but as the community has also some role in it. Also the insurance companies and also the NGOs who can help collaborate and create a fund, because when patients get help, this will also help in screening. Screening will lead to early detection, and early detection will lead to less cost in cancer care.
I have a simple question. Have you